Welcome to City TV Studios. I'm Frederick Perry, Human Resource Director for the City of Douglasville. February is Black History Month, and this special presentation will focus on specific medical conditions that predominantly affect the African American community. In just a moment, we'll talk about some very important and very personal medical challenges that we're dealing with. And now I'd like to give our panelists an opportunity to introduce themselves.
Hi, I am Councilwoman LaShun Burr Danley.
Hi, I'm Marcia Hampton. I'm the Community and Downtown Services Director with the City of Douglasville.
And again, I'm Frederick Perry, and I'd like to introduce our special medical guest and our host for this special presentation, Dr. Wiliiams.
Thank you so much. I'm India Wiliiams. I'm a family practice physician. I work with the Douglasville Medical Group right here out of Douglasville. We're located near the hospital, but my clinic is located in Villa Rica, Georgia. So I'm a satellite location of the Douglasville office. Most of my colleagues are internal medicine, but I am family practice. So I have training in medical conditions that affect persons from birth to death. So from 1 month old to 99 years old. So today we're going to discuss some primary care issues and some very specific issues that affect the African American population. And that's what my panelists are here to help me with. Some of them have dealt with some of those issues, and some of them have cared for people through some of those issues. So I'm going to throw it back to them and kind of let them talk to us about what their experiences are, and we'll take it from there.
Well, actually, and thank you, Dr. Wiliiams, I just recently experienced being a caretaker or caregiver for my sister, who was diagnosed in August 2011 with esophageal cancer, which is some people refer to as throat cancer. So that is what I'd like to speak on and elaborate and talk about.
How old was your sister?
My sister was 58 when she was diagnosed.
58. Okay. And what were some of the things that she was experiencing that made her go, I think I may need to go see someone about this? What was the beginning things that made her think, I need to go see a doctor?
Actually, my sister, she was my oldest sister, and she recently went home to be with the Lord on November the 20th. She was diagnosed August 20th of 2011, and she passed on November 20th. So that was really quick.
Yeah, short window of time.
Very short window. You know, actually, I am not sure specifically what my sister experienced in her own way. However, my mom and myself, along with her daughter and other siblings, noticed that my sister had began to lose a lot of weight. And also she got to the point where she could not swallow. At that point is when we began to proceed and seek medical assistance.
It's not unusual to hear that. Those are some of the primary things that people with esophageal cancer will complain of. I would have loved to have known kind of those early on symptoms, because getting to the point of not being able to swallow, you're at advanced stages. If you can't swallow liquids and can't swallow food, something major is happening.
Right.
And, you know, one of the most common causes of esophageal cancer is smoking. So I would be curious to know if your sister was a smoker or not.
She was a smoker. However, her oncologist also stated that it was from untreated acid reflux.
Really? Wow. So okay. Well, acid reflux can cause cell changes that will lead to cancers. And what happens primarily is that the acid that's in your stomach, as it's refluxed, and that means that it actually leaves the stomach and travels back up into your esophagus. Your esophagus has certain cell types in it, and those cell types are not designed to handle acid. Your stomach produces acid. So when you take acid and put it in a part of the body that it's not supposed to be in, cells have to change and adjust. And that changing and adjusting of the cells to deal with this new, I won't say toxin, but this new irritant is what cancer actually is. It's the changing of normal cells in the correct place to abnormal cells. They change. So the acid, as it came back up into her esophagus day after day, hour after hour, minute after minute, caused those cells to have to adjust. And in that adjustment, they became abnormal cells, and then the cancer develops. Also,
After my sister had reached a point of not being able to swallow liquids, and this was actually in the last stages, I was very shocked to know that her father and her aunt also had experienced the same type cancer. And then my aunt on my mother's side also had that cancer. So my question to you is, could that be genetic or hereditary?
Usually, and in medicine we have to say things like usually or normally or most of the time. We can't say 100% this, 100% that.
Right.
Usually esophageal cancers are something we've done. So it is the smoking, it is the tobacco use, it is the types of food that we eat, it is the reflux that is moving from the acid that's moving from your stomach back up to your esophagus. But it sounds like in this case there may be a genetic component. If multiple people in the same family are having the same type of cancer, it's kind of obvious that there's some connection going on there. The other explanation could be is, did you come from a long line of smokers? Is everybody in the family smoking? Did the other people that have the esophageal cancers, were they heavy smokers? Did they have untreated, long-standing, significant reflux issues? But for the sake of argument, most esophageal cancers are something that we're doing.
Wow. And for me, for preventive, just watching or being very observant of things that I eat, I've noticed that even with myself at night, and I think for me, it's just eating after hours when I shouldn't be eating, and not sitting up and having enough time to swallow, or hitting and missing and not sitting and having a decent time to digest the food. So,
well, with reflux, there are a couple of things that we can do in our lifestyles that will help with reflux in general. So, eating late at night. In a seated position or a standing position, just with gravity, it's harder for things to come up. But when you take an upright person and lie them down, it's now easier for fluids to travel from your stomach to your esophagus, just because gravity is not working for you at this point. But when you're standing, gravity is working for you. So that's why a lot of people say that their symptoms get worse at night. It's not that your symptoms get worse at night, it's that you're lying down.
Oh.
And your symptoms are worsened because of gravity is now not working for you, it's working against you. Gaining weight. The heavier we are, the less effective our sphincter becomes, our lower esophageal sphincter becomes. So I know everyone says weight has to do with everything. I mean, you can contribute gaining weight to everything, but with reflux, it's true. The lower esophageal sphincter is the doorway, let's say, from the esophagus and your stomach. And it's just a band of muscle that is supposed to close off your esophagus to keep things from coming back through your stomach up into your esophagus. Well, if that sphincter is loose or not working properly, it makes it easier for the doorway's open and things can come back. But when that sphincter is working properly, the doorway's closed, and it's much harder to reflux through a closed door. The more weight we have on our bodies, the more fat we're carrying around, the more pressure that sphincter is under, and it has a tendency to not work as well.
Wow.
So that's another thing. Also, knowing the foods that cause your reflux is important. Knowing to stay away from certain things. Tomatoes, peppermint, a lot of caffeine. Those things, and spicy foods, and the foods that we like can get us in trouble. But knowing what your triggers are is very important, as well with reflux.
So, can I ask a question?
Sure.
What would be some, some real defined characteristics for me or anyone else who's watching to say, you know what, I think I really need to go see a doctor?
Is that in terms of reflux or in terms of esophageal cancer?
Both.
Both. Okay. Okay. They're going to be the same. reflux and esophageal cancer because the organ that's involved is the esophagus, and it's whether it's being irritated because of cancer or it's being irritated because of acid, the presentation is the same.
Okay.
So before you get to the end stages of difficulty swallowing, whether it's swallowing liquids or solids, you look for things like mild abdominal pain, certain foods causing heartburn, a pain with, not difficulty, but just a discomfort or pain with swallowing certain things. Finding it difficult to maybe swallow pills, your high blood pressure medication. You know, it may be fine in March, but all of a sudden in April, it kind of hurts a little bit to swallow that pill. Those are things to kind of look out for. Having a bitter taste in your mouth.
Wow.
You know, you wake up with a bitter taste in your mouth, or after you belch, you have this constant bitter taste in your mouth. That's the acid that's coming back. Throat irritation, having to clear your throat very often. Coughing. Coughing, there are three things that we typically tell people to look at when you're coughing. Asthma, postnasal drip, and reflux. Reflux is a very common cause of chronic cough. You're just coughing for no reason and you don't really realize why. That's the acid, that's the irritation. So those are some of the earlier things that you look for, but most people typically complain of heartburn or pain right here. It kind of hurts right here. Those are the early on things that if you can catch an esophageal cancer at that stage, or if you can catch a reflux at that stage, as opposed to I can't swallow anymore,
Right.
you're much more likely to have a positive outcome.
Okay. That sounds great. Thank you.
No, thank you.
I would love to just make sure that you talk about your health issues with family. If you don't feel comfortable with family, talk to someone that will listen. And also, just if you don't have health care, there are other measures that you can tap into, such as your local health department. Also, there are a lot of health fairs that go on throughout the city of Douglasville and some other area. Just talk to someone, and someone may be able to refer you to a source where you can get help. I do believe in preventive medicine, preventive medication, but please, I can't stress anymore that talk about your history, talk to family members, talk to a friend, and best wishes and great health. Thank you.
Good afternoon. We're continuing our discussion today about medical issues that have predominantly affect the African American community. And we're going to ask one of our panelists about her experience with her medical condition. Marcia?
Well, I actually suffer with Crohn's disease. And I guess the funny thing with my diagnosis was that when I initially went to my family practitioner, I had assumed by diagnosing myself that I had some type of irritable bowel issue.
Irritable bowel. Yeah.
But at the time, my doctor refused to diagnose me with it because I was African American. His assumption was that, and actually he had mentioned it to me, he said, well, I doubt that you have this type of issue, specifically Crohn's, because you are African American and typically it does not affect the African American community. And at the time I was 35, and he said, well, and plus you're 35, and typically if you have Crohn's, it would have affected you at that point. It would
have shown itself by now.
Correct. So, you know, I've been dealing with this for the last 3+ years, and my struggle has been that, just getting diagnosed from that point of talking with my family practitioner and making certain that, or forcing the issue of going to see a GI specialist. And once I got to that point, going through the level of testing to actually say that I do have Crohn's disease and what those tests meant. It wasn't just, you know, looking and going online and thinking about the symptoms, but it was going through having a colonoscopy, having blood work done, testing the inflammation in my body. And I didn't have any family history of any of it. Right. More or less so, maybe not because no one had it, but I come from a family history. You only go to the doctor if you're sick, right? And you're literally sick. You can't self-heal yourself. So my parents took us to the doctor, but I didn't go that often because as a child I was really not sick. And this really, and I tell people all the time, the struggle that I struggle with constantly is I view myself as a healthy person. This is the only issue I have, but it's a big issue.
Right. So
mentally, it's been a tough struggle for me, as specifically dealing with the fact that it's aggravated by stress, the type of job that I'm in, and having to remember, and because there's not a clear-cut answer to nutrition also, that somebody can't tell you, okay, you don't eat tomatoes. No, some people with Crohn's may be able to eat tomatoes, you know, that kind of thing. So it's
kind of individualized,
correct,
the disease process.
Yeah.
So what were some of the things that initially made you go, I think I need to go see a doctor? Because I want people out there to hear your story and understand, don't ignore diarrhea. Right. Don't ignore abdominal pain. Don't ignore rectal pain or anal pain. Right. Don't ignore blood in your stool. Those are not normal things. And if they're coming and going, or coming and staying, and then coming and clearing up for a while, and then coming back, and you're in this pattern of waxing and waning, coming and going, that's not normal. So kind of tell us, in your own words, what happened?
Well, it was, we were going through a stressful time at work, so I was already feeling acid reflux, and I've had that throughout the course of even when I was in college. My last semester in college, I had gone to the military first and then the college. I was enrolled in 21 hours just to graduate. That's all I needed to graduate. So in my mind, I needed to get out of there.
Gotcha.
And I was also working 2 jobs. So at that time, I was dealing with acid reflux. I'd also gone back to the doctor, and they had diagnosed me with IBS, with constipation, because I was having issues with that. So
this is how old?
I was 22, 23 at the time.
So 22, 23, you're having reflux issues, and you're having constipation issues.
Correct.
Okay.
So I got out of school, got into some type of settled pattern. A couple years went by. Still had a little bit of the issues with the IBS. I'd even at that point I'd moved to Atlanta a couple years after that and started to see a GI specialist. There was a new medication, I think it was called Zelnorm at the time. It was going through a trial medication, so they gave me that medication. It kind of sort of worked, but then it was recalled.
Right.
So I was not able to get any type of medication at all for any of my issues, but I started to get into a pattern of settling into what were my typical bowel patterns for me.
And what was that at that age?
At that age, and this is probably going to be shocking to some people, going to the bathroom, having a bowel movement maybe 1 to every 7 to 10 days. Okay. That for me was okay.
Gotcha.
I dealt with bloating, having horrible bloating and cramps during my menstrual cycle. It was agony, but it was an agony that I only dealt with once a month, and I was able to put up with it. Well, as time went on, marriage, family, 3 years ago, job getting a little bit more stressful, still dealing with the constipation, but then I started to lose a significant amount of weight. I started to feel achy. I was running fevers at night. My skin color was almost green. And people around me were saying, what's wrong? Right. Are you tired? You know, what's going on? And I was just like, I couldn't put my finger on it. I said, I just don't know. Something is not right.
So at this point, you're still having the constipation.
Still having the constipation.
You're still having some abdominal bloating.
Still having that.
Were you having any abdominal pain?
I started to notice symptoms where, depending upon what I ate, it was literally like somebody stabbing with a knife. Okay. So I started cutting back on the food.
So abdominal pain with certain foods.
With certain foods.
Constipation.
Skin changes.
Body aches.
And
feeling bad.
And fever and feeling bad. We were getting ready to go on vacation, my husband and I, for the summer. And I felt like, okay, the summer vacation was going to be a good break. At this point, I hadn't seen a doctor. Okay. I'm 35, hadn't seen a doctor, and I'd gone shopping for summer clothing because we were going to Orlando. I noticed that at that point, my clothes size had dropped about 4 sizes. I'd gone from an 8 to about a 4. Okay. And I said, okay, that's okay. That's just the stress. And maybe the reflux is the stress. Well, we get down to Orlando, and I bought the clothes 2 weeks prior to. The shorts were falling off of me.
Okay.
We went to a restaurant, and I had a glass of water, and I threw up. The whole vacation, I was I couldn't keep even water on my stomach. I left Orlando all the way back to Augusta to my in-laws, and prior to going, the whole time there, I had a hemorrhoid, and I could hardly even sit. So here I am dealing with fevers, a hemorrhoid, aching, can't go to the bathroom, and I just literally, at that point, I'm thinking I'm going to lose it. So I go back to my doctor, and I'm telling him about all these symptoms, and what he's looking at me, and he says, well, what I need you to do, he tells me to drink some prune juice and a variety of things to eliminate the constipation. That does not work. He looks at the hemorrhoid. It was a thrombosed hemorrhoid, so it wasn't the typical type of hemorrhoid that people think. I went to a surgeon.
Right.
And he started telling me about how he was going to have to remove it, and I'm sitting thinking, what is going on with me? And finally, and one day at work, I was feeling so off that I couldn't focus. I was feeling very weak. I drove myself to the emergency room here at Douglas Wellstar. They did a variety of tests. They did all types of things, and they said, you just have poop in your colon. And at that point, I could have cried. Because I knew something
You knew something wrong. Your spirit was telling you that there's something more going on.
So finally, with my husband, we went back to my family doctor, and I said, look, I can't take this any longer. I need to see a GI specialist, and he wrote me the referral. And within probably 2 seconds of seeing Dr. Minocha, who's my doctor, he said, have you ever been tested for Crohn's? And I said, no. And it was like a weight had been lifted off. We went through the variety of testing, the blood work. He scheduled me for a colonoscopy. And, the funny thing was, and not necessarily blaming any doctors, but I guess my advice to everybody, you just really have to listen to your inner spirit telling you.
And you have to be an advocate for yourself.
You have to. Was that even in the emergency room, one of the questions he asked me, he said, did anybody point out to you about your inflammation levels? Because they had done a blood test there while you were in the emergency room. And I said, no. And he said, well, all the signs were there. He said, they probably just didn't pull the test together. But from that point, going through all of that, that was about a 6-month period. I was put on prednisone, anti-inflammatory, and a mixture of a variety of other medications to try to heal my colon. Because mine affects my small intestine. Finally, it got to the point where I was still having the flare-ups. Yeah. So now I'm on a drug that's called Cimzia. It's a biologic. It's just like Humira. Some people take those types of drugs for RA.
Is it an injection
or
an
infusion? It's an injection, and I take it once a month, 2 vials, either in my abdomen or in my thighs. One of the recent things that I have discovered is that definitely for women who have irritable bowel disease, it's a very different disease for women than it is for men, because during your menstrual cycle or if you're going through menopause, the symptoms worse. They almost feel like you're going back through a flare-up, but the moment that it's over, you go back to normal. Why that is, I don't know. I haven't been able to find any answers or any conclusion as to why.
Usually we say hormonal levels, the fluctuation of the hormones. What I want to say is your story is, I know you weren't diagnosed as early on because you're an African American.
Right.
And I know we're doing disease processes that primarily affect African Americans, but Marcia has one that is not known to affect us in the numbers that it affects Caucasian Americans. So the bias delayed your diagnosis for a while.
Right.
That's just being honest. But a lot of your story, all of your story, is kind of the natural progression of Crohn's. And Crohn's is an inflammatory bowel disease. And typically Crohn's shows up late teens, early 20s. Yours showed up in your early 20s. You just didn't know what it was.
Right.
And you were thinking, oh, I'm just a little constipated. Oh, I'm just having a little reflux. Those were the mild beginning stages of your Crohn's. Fortunately, for most people with Crohn's, they stay in the mild stages. So all they may have is a little constipation or a little diarrhea every now and then or a little abdominal pain. But yours progressed. Stress, big trigger for Crohn's. Like you said, We're trying to understand if there's a nutritional component, if there is an infectious agent component of Crohn's. So all those things are being looked at. But it has to. Well, we used to say Crohn's is an autoimmune disease, which means that your immune system, for some reason, is attacking your gut. It's attacking your small intestine, it's attacking your colon. And actually with Crohn's, which makes Crohn's a little bit different than ulcerative colitis, is that Crohn's can occur anywhere from your mouth to your anus, anywhere along the GI tract. That makes it different than ulcerative colitis. Ulcerative colitis typically, remember I can't say 100%, but ulcerative colitis typically only affects your colon. Crohn's, anywhere. Crohn's is a disease of inflammation, ulceration, swelling, irritation of your GI tract, anywhere from your mouth to your anus. Interestingly enough with Crohn's, it also can affect you systemically, which means other parts of your body. It can cause eye irritations. It can cause skin changes. It can attack anywhere in your body. So the green skin could have been that you were dehydrated, could it have been that you were vitamin deficient, or could it have been the Crohn's attacking your skin? You mentioned that you have Crohn's in your small intestine. About 40% of Crohn's shows up in the ileum. That's the third segment, or the part of your small intestine right before it attaches to your colon. So you have your small intestine, you have your large intestine. Role of your small intestine, basically to take out all the good things, all the nutrients, all the vitamins, all the things that you need, all the nutrition for your body. Your small intestine is responsible for absorbing that from the food that you put in. And then anything that it can't use, it sends it to the colon. In the colon's job is to extract water from what was sent to it. So your small intestine produces this soup-like consistency waste. It sends this soup waste into your colon. Your colon pulls water out of that waste to keep you hydrated, and then it starts to solidify, and that's what your stool ends up being, this solid brown poop. And that's what you expel. Interestingly enough, your Crohn's occurred in the area, in the ileum, where about 40% of Crohn's occurs. The ileum is responsible for B12 absorption. More than likely, I don't know you, I can't give you your diagnosis or tell you how you feel, but more than likely you're going to have a B12 deficiency, because the part of your small intestine that's supposed to absorb B12 is affected by Crohn's. It means that it can't do its job very well. Some of that green skin, some of that fatigue, not feeling well, the aching, may have actually been a B12 deficiency. I don't know if you're on B12 now or not, but you know that a lot of people are.
And then it's to your point, I remember I'd gone in at one point, I can't remember at what stage of the medication I was on, but I was suffering a significant amount of hair loss. I mean, to the point that I could do this and hair would just come out. Shower, hair was coming out, and the exhaustion was at a level that I could literally not keep up, and I was told to take B12. And I do take some B12, and it kind of helps because I still suffer with the exhaustion. And in my mind, it's probably at a level where it shouldn't be for my age and for my level of activity. I've tried to manage it by when my body says to shut down, I shut down, and I try to listen. One of the things, and I don't know this for a fact, and you may have an opinion on it, I'd read somewhere, and I can't remember where I had read it, was that as a child, I suffered horrible canker sores. I mean, to the point where my parents couldn't understand where they would come from or why I would get them, and I didn't have braces at the time.
Okay. Could you tell everybody what a canker sore is, or to your experience, what your canker sore was? A canker
sore is an ulcer that appears in your mouth. It could be on your gum line. It could be anywhere in your cheeks, on your lips. Most often, I would get them, not just one, but I would get them 5, 6, 7 at a time. For a point, they thought it was maybe the acid in the food, so my mom took me off of orange juice, anything that had acid, but it never improved. And over the course of the years, I did as a teenager get braces, and I would develop them, but I did notice in my early 20s, specifically during that time when I'd gotten sick, the more I would stress that I would get them. Now that I've been able to develop a pattern of managing stress, that I don't, but I've always thought in the back of my mind that maybe that was something associated with the Crohn's because of how it did affect my mouth.
And let's go back to what we said. Crohn's is an inflammatory bowel disease. It can affect your GI tract anywhere from the mouth to the anus. It is an inflammatory, ulcerative, irritated, swelling disease process. Ulcerative. Ulcers in the mouth that are occurring for no reason. Very easily could have been your first sign of Crohn's. The ulcers in the mouth that just keep coming and keep coming and keep coming and coming in multiples. Yeah, very easily.
So that is my story, and it's because I feel like I'm relatively newly diagnosed. I mean, now I go through the process of looking back on things just like that, and just trying to watch what I eat. Manage my level of stress. I try to make certain that I do incorporate exercise. I have found that exercise helps. The winter is the hardest because I have been suffering with some of the joint issues. I don't necessarily know if the joint issues are derived from the medication that I'm on. I have read that that's one of the side effects, or if it's actually the Crohn's. So right now the biggest two things for me are keep maintaining a good spirit about it, because it is just Crohn's, but also realizing that if I don't take care of myself, that it can develop to something that can be cancerous. But just making certain that I'm being attentive to my body and listening.
Okay. Well, just for viewers out there to understand, Crohn's disease is an inflammatory bowel disease. Has two peaks, usually shows itself late teens, early 20s, or 40s to 50s. So there's a second peak. There's a second group of people out there with Crohn's disease that may have made it up until 45 or 50, and then that's when it hits. And some of the things that you're looking for are blood in your stool because of the ulcers and the inflammation in your colon and small intestine, abdominal pain, bloating, not being able to tolerate certain things, weight loss. Some of the things.
The fevers were, I think, was the biggest indication of just a fever for no reason. They would really peak at night, and it was a high-grade fever. The achiness for almost flu-like symptoms that I was suffering, but the weight loss definitely and the fevers were the biggest.
So if you have kind of this waxing and waning, coming and going, GI issues along with fevers and body aches and maybe some skin changes and maybe just some unusual other symptoms, you may need to talk to your doctor about Crohn's or any of the other inflammatory bowel diseases. Oftentimes, inflammatory bowel diseases, Crohn's and ulcerative colitis, are often diagnosed initially as irritable bowel because a lot of the symptoms are the same until they start to progress. Irritable bowel really shouldn't give you blood in your stool. Irritable bowel really shouldn't account for tremendous weight loss. Irritable bowel shouldn't account for mystery fevers and mystery body aches. So even if you have the diagnosis of irritable bowel, but you're experiencing these other things, or your irritable bowel is not responding to any of the primary care treatments, be an advocate for yourself and ask, hey, can you send me to your GI doctor? Can we do the next step test? And oftentimes the next step tests are looking for your inflammatory markers. Those are things called SED rates and CRPs and colonoscopies. It's very difficult to diagnose an inflammatory bowel disease without a colonoscopy because it could be so many other things, and it can masquerade as, and it's like a chameleon. It can hide itself and present many different ways. So you're thinking a skin disease when it's really Crohn's. You're thinking the flu when it's really Crohn's. So if you have a compilation of symptoms, they don't really match, and you have the abdominal pain and the blood in your stool and bloating, ask your doctor to send you to a GI doctor. And there are two ways to diagnose it definitely. That's a colonoscopy. And then they have something new now, because if you have small intestine Crohn's, you can't really see it with a colonoscopy all that well. They have a capsule endoscopy, and that's when you swallow a pill. Well, you think it's a pill, but it's actually a camera. You swallow it, and it takes photographs every few seconds from the time you put it in your mouth until the time you expel it. You know how to expel it. And you can get really good images, and you can see some of those ulcers, you can see some of those irritations, you can see some of that inflammatory, swollen, boggy bowel that really makes a diagnosis for you. Wow. Well, thank you for sharing your experience, and it wasn't a good one, but it's going to get better.
Yeah, it's better.
And we'll be back to talk about hypertension.
There is huge value, huge incentive in making certain that you seek medical attention when you know that there is something wrong with you, something wrong with your body. I do believe in the importance of making certain that you are at one with what's going on with your health. I do recommend, highly recommend, that you take advantage of some of the information that was provided in the program today, and I wish you the best and the best health.
Thanks for staying with us, and now we're going to turn it over to one of our panelists to talk about his experience with hypertension.
Well, it was about roughly around 1995, 96, and after I graduated college, I was experiencing these bouts. Really, throughout college, I was experiencing these bouts where my heart would just start racing, and it would race for a little bit, and then it settled down. And you know, I've always been an athlete all my life. I played sports, and so I just self-diagnosed and said, you know, I just need to sit down for a little while. And things started getting a little bit worse with them. They start coming more frequently. And then I started experiencing nosebleeds. So I said, well, you know, whatever. And, you know, it was doubly bad for me because men just don't like to go to the doctor. You know, we'll self-diagnose all day, you know, and we'll put a Band-Aid on it, and we'll keep moving. So finally one day, and it was terrible for me because everything lined up for me to go to the doctor. I was working for a health maintenance organization. My health care was free. and I was in the office, and my heart started racing, and this time it wouldn't stop. And it was going on for a while. And I just said aloud, I was thinking out loud, I was like, wow, my heart is racing. This time it won't stop. And my colleague who was sitting next to me, she said, well, you need to go to the doctor. And I said, well, yeah, I'll do that. And I went back and I started doing what I was doing. And she got up and she came over to me and she said, no, I want you to stop now and go and make you an appointment. And I did just that. And I called in, I made an appointment, and the person there told me not to drive. And when I got there, I checked in, and so just so happened I ran into the person that I called, and she said, you drove, didn't you? I said, yeah, I drove. So they went in, and I told them what was going on, and they asked me, had I experienced that before? I said, yeah, but I didn't experience it for that length of time. And she put the blood pressure monitor on my arm, and she looked at it, and I can tell from the expression on her face that something was wrong.
It was a significant blood pressure.
Exactly.
Yeah.
And she took it off, and she told me to just relax. And she came back in 5 minutes, and she put it back on, and she looked at it, and she didn't even take it off this time. She just dropped it and left. And she came, and at that point, doctors started coming in and out. And they put me down, and they told me that I was at a stroke level. I can't remember exactly what my blood pressure was at the time, but they said if I had waited, you know, really, I was beyond the point of a stroke, and they were just amazed that I hadn't had one at the time. So he told me, obviously, you have high blood pressure, and you're going to have to start taking this medicine, and it took a while for it to sink in. And I did, I think, what any man would do when faced with such a crisis. I called my mom, and I called her because she always knows what to tell me at the right time. And much like I was telling LaShun and Marcia off camera, that a lot of their stories coincide with mine, and that when I told my mom what I was diagnosed with, she started telling me that my father, my brother, my uncle, and a lot of my family members were diagnosed with hypertension, and that I shouldn't worry about it, and I should follow the doctor's orders, and so on and so forth. A couple of things that the doctor informed me to do that were, it doesn't sound hard to you all, but to me it was very hard. One thing was he told me that I couldn't have cheese anymore.
Cheese, okay.
And I'm from Wisconsin.
Oh.
And that's all we do is eat cheese. You know, Wisconsin sharp cheddar cheese is you know, it was just, that was very hard for me. And much like what Marcia talked about in terms of the stress piece, when my heart started racing at that point in time, I was working during the day and I was going to grad school at night.
Ooh.
And it was some very long days and some early mornings and so on and so forth. So my doctor told me that I was going to have to give up one or the other. And I wound up leaving my job, and things worked out where I could go to school full time. And he put me on some medication. And again, man, we don't like to take medication. And I said, well, things have been going pretty good. I haven't had the racing heart or my nose wasn't bleeding for a while. So I said, I'm not going to take this medicine.
Of course.
You know, I'll just drink a lot more water and eat my vegetables and so on and so forth. And I went back and my blood pressure had gotten worse.
Mm-hmm.
And he told me, he said, well, I'm going to put you on another medication. And I told him, I said, Doc, okay, I hadn't been taking my medicine. You know, could you allow me the opportunity to take this medicine? I'll be back in a couple of months.
I hear that all the time. All the time.
And he said, okay, we'll do it. But if you don't, you know, we're going to do some more extensive medical treatment on you. And ever since that time, I've been on a strict regimen in terms of taking my medicine, watching what I eat. I still struggle with the cheese thing, but it's gotten a lot better. I'm still borderline, but I fall on the right side of the fence in that my blood pressure has been stabilized for some years now. I've started running more, and I'm just, you know, just more cognizant of what I eat.
Well, you touched on a lot of things in sharing your experience. The first thing I'd tell you is that your story is very common. I hear that all the time. There are a couple of things I could just interject and change one piece of it, and it would be someone else's story. Mm-hmm. So you had palpitations, fast heartbeat. That was your motivation to go be seen. That and the nosebleeds. Mm-hmm. I could substitute that with headaches. A lot of people complain about headaches with having high blood pressure. Mm-hmm. I could substitute that with chest pain. I could substitute your complaint with shortness of breath.
Okay.
I could substitute your complaint with blurry vision. So there are a lot of signs and symptoms of hypertension that we recognize, but that we don't do anything about. Chest pain, shortness of breath, palpitations, nosebleeds, blurry vision, mystery headaches are all indicators of hypertension that we often ignore. What I'd like to stress to you and to anyone else out there with hypertension, or if you think you have hypertension is called the silent killer for a reason. And that is because, you know, you were an extreme. You had stroke level blood pressures when you went in. So you had to be started on something immediately. But what often happens is that people, I just have this headache and it's eating at me, it's gnawing at me, and Tylenol takes care of my headaches. So we go years with using Tylenol to take care of these headaches, and we never understand, well, why are you having the headaches? Stress, life, my mom, my dad, my kids, my job. We blame it on everything and never stop to think, why am I having headaches? Why am I having chest pain? Why am I short of breath? But those people's blood pressures are the 150s over 90s, the 160s over 90s, 145 over 90. So that when they finally do go and are diagnosed with hypertension, and they get the diagnosis of, you know, your blood pressure is 152 over 92. Those numbers are not as shocking as your blood pressure is 225 over 120. So they don't take it as seriously. 225 over 120, that'll kill you then. That'll give you the stroke. That'll give you the heart attack. That'll take you out quick. 150 over 90 doesn't kill you right then. It's the silent killer. It affects your body over time. So when you have the hypertension at 20, you don't do anything about it. At 30, you don't do anything about it. It doesn't bother you at 20 and 30 other than maybe some headaches or a little blurry vision. But what it's doing is that it's affecting your heart. It's damaging your heart day by day, moment by moment. It's damaging your kidneys day by day, moment by moment. It's damaging the arteries that lead to your eyes so that you can see. It's damaging the arteries that lead to your legs so that you can walk and you have good blood supply to your legs and your feet. And you don't worry about it when you're 20 and 30. But suddenly when you're 50 and 60 and you can't walk from your bed to your kitchen without giving out a breath and you don't know why, it's because the blood pressure has slowly damaged your heart over those 30 years. When you go to the doctor and they tell you your kidney function is slowly increasing, your kidney tests, are slowly increasing, but you're not having any problems urinating, so you don't think about it. Until all of a sudden when you're 50 or 60 and you don't urinate quite as much as you used to, your kidneys have been affected. When your feet hurt when you walk from here, from your bedroom to the kitchen, and you don't know why, and you have to sit down and rest your feet because they feel like someone's sticking you in the bottom of your foot with a knife. Those things are effects of long-term, uncontrolled, undiagnosed, untreated hypertension. And that's where I'd like to stress. Yeah, when you get the really high blood pressure and the people tell you you're at stroke range, someone telling you you have high blood pressure in the stroke range, it's very shocking. And most people will do something about stroke range blood pressure. The patients that I see and that I struggle with on a daily basis is trying to get the person who has a blood pressure, like I said, 150s over 90s, that doesn't have any symptoms. So they don't understand the significance of handling that problem now and not later, because it's not affecting them now. But like we were saying, high blood pressure, heart attacks, strokes, renal failure, which means dialysis, peripheral artery disease, which means amputations, blindness. Those are real outcomes of long-term untreated hypertension. And unfortunately for our community, there is a disparity in hypertension among African Americans than any other race. 1 in 3 African Americans have hypertension. 1 in 3. So it's 4 of us sitting here. Myself as well. So
and I don't.
On this panel here, 50% of this panel has hypertension. 1 in 3 African Americans have high blood pressure. 40%, now hear me, 40% of African American men have high blood pressure. So we need to be aggressive, we need to be serious, and I need for my patients to take it seriously. I'm not worried about you now, I'm worried about you in 20 or 30 years. I want you to be able to, when you're 65 and 70, to be just as spry and outgoing as you want to be and do the things that you want to do. But you got to start on that now. A couple other things about hypertension. Well, what can we do besides medication? Well, the big 3 medical problems in this country are high blood pressure, high cholesterol, and diabetes. Does anyone here know the #1 treatment for high blood pressure, diabetes, and high cholesterol? #1 treatment?
Losing weight.
Weight loss. So the things that we can do without medication, if we really want to be serious about it, are exercise and eat a healthy diet. If we did those things, high blood pressure, diabetes, and high cholesterol would drop drastically, the rates of it. Other things that we can do to decrease hypertension, the rates of hypertension, not only in the African American community, but in this country, are stop smoking and decreasing our alcohol intake, making moderate to low volumes of alcohol. But the more fat you have on your body, it makes it harder to treat hypertension with excess fat on your body. And not only does it make it harder, but it actually, in some cases, will cause hypertension. And lastly, what I really want to say about hypertension is salt intake. Salt does not give a person high blood pressure. So I can't give Marcia a high salt diet and she's going to have high blood pressure. It doesn't work like that. But if Marcia has high blood pressure and she takes a high salt diet, it makes it much worse, makes it harder to treat, makes it harder to control, puts you at greater risk for the heart attacks and strokes, okay, for those things to happen. So reducing your salt, not smoking, exercising, and weight loss are all things that we can do to reduce our likelihood of having hypertension, and if we do have hypertension, to manage it and control it even better. Okay.
I guess one frustrating thing for me was that, most of the symptoms that, are typically related to hypertension, I didn't have them. I wasn't overweight. I was not a smoker. And I just didn't understand why.
Right.
And I did. I went through a little depression when they told me that, you have this condition, you have to deal with it. And, these are the things that you can't do. I guess the restriction of it all was depressing to me. And, I was an athlete, so I didn't lead a sedentary lifestyle. It didn't make sense to me.
Hearing that you were an athlete, I'm surprised that with any of your sports physicals, that no one ever mentioned to you earlier that your blood pressures may have been a little bit elevated. So, I catch, when I do sports physical, I catch a lot of African American males, 17, 18, 19, yes, that early, 17, 18, and 19, that have high blood pressure. That I'm starting on medications at 17, at 18, at 19.
Wow.
And for our community, there is a strong genetic component. There's some theories out there, and I'm not going to go into the theories, but there's some theories out there as to why it affects our community at such an alarming rate. And that has to do with salt. It has to do with many hundreds of years ago. Being highly salt sensitive was a good thing in terms of survival. But so a lot of African Americans, this is a theory, I'm not going to go into it, but being salt sensitive was a good thing many years ago, and we think that being salt sensitive is something that is genetically more likely to occur in African Americans. Wow. Well, thank you for tuning in. I hope something that was said, shared by our panelists, opens your ears, affects you, makes you more interested in your health, makes you want to be more aggressive about your health, and have you to go to your doctor and talk to them about the things that are concerning you. Even if it's not something that we talked about here today, esophageal cancer or high blood pressure or Crohn's disease, but if it's something that's bothering you and it's been bothering you long enough, then it's worthy to mention to your physician. Take care, and see you soon.
I want to thank you for tuning in to this special presentation of medical conditions that predominantly affect the African American community. I want to speak specifically to those men and women out there that may be suffering from hypertension. I want you to take that condition very seriously. Some of the symptoms that we talked about during the show, if you're experiencing those symptoms, please, I can't emphasize to you enough to see your primary care physician or see a physician of your choice to get those situations dealt with. Best of health in 2012.